As a house officer, you are not to take decisions on your own. Hi, Dr. Augusta here, and I'm here to answer the question that somebody asked in my comment section on YouTube. And the person asked, what are the responsibilities of a house officer? Who is a house officer? First of all, a house officer is a newly qualified medical doctor that is working under training for a period of 1 year. This 1 year involves rotations through 4 departments for a duration of 3 months each. These departments include internal medicine, surgery, pediatrics, and obstetrics and gynecology. So what does a house officer do? A house officer collects patients, we ask them questions, we examine them, and we check on them every day for as long as they're going to be in the hospital. So every morning, the house officer is usually the first doctor that a patient would see. The house officer then relates whatever findings to the rest of the team. The house officer also takes samples for investigations and administers intravenous medications. In my center, the house officer administers all intravenous medications, but in some other centers, the house officer only administers drugs with narrow therapeutic index. As the house officer, you are the connection between the patient and the rest of the team, say the registrar, the senior registrar, and the consultants. So you'll be the one to check on the patients to see if there's any complaint or to see if they are doing well with the treatment. As a house officer, you are learning on the job. Remember, I said it's a 1 year training period. So during this period, you are expected to learn through whatever you do, because after this 1 year training, you are more like going to be on your own. So it's a period of learning from your seniors. And also, as a house officer, you do calls. You are usually the first on call. That is, you are the first person that is not usually call if there is anything going on in the ward with patients. So when you are called, you examine the patient or ask questions and put your findings together and then inform your senior on call. As a house officer, you are not to take decisions on your own. So if you are to encounter any difficulty or you find out that anything is going on with the patient, you are supposed to inform your next on call before making decisions. And also, the house officer is the one who prepares a patient for surgery. That is, you send for the items that will be needed for the procedure. You ensure that the consent form is signed. You ensure that the patient has been grouped and cross-matched and blood is available in the blood bank for the surgery. And also, the house officer, at least in my center, is to ensure that investigation results are available after they've been requested for. As a house officer, you are also to make sure that the plans of your senior, that is your registrar, your senior registrar, or your consultant, has been carried out. So we go through plans and make sure that they are carried out. So the house officer is the doctor that you would most often see in the hospital, because we are like the connection between the patients and the consultants. So that's majorly what I can remember now. If there's any other thing, I'll make another video or drop it in the comment section. If you have any question, let me know in the comment section. Thank you for watching. Bye.